what is the difference between a migraine and a headache?
Migraines are a spectrum of very specific headaches. They tend to be associated with other things, so people often have problems with bright lights, problems with loud noises. They tend to occur in the same areas, and they tend to occur with a high frequency. So these are patients that get headaches anywhere between a couple times a week to 10 or 15 times a week.
Wow.
When they have them, they have to get away from lights, they have to get away from sounds. There are things that can trigger them. We know that certain types of foods can trigger them. We know that certain lights, certain noises can trigger them. And these are patients that then are usually evaluated by neurologists because they keep having these episodic headaches.
So would you call it a headache? A migraine is like worst headache, or?
No, and a lot of times when that worst headache in the world is used, it has to do with more specific and worrisome types of headaches that could be associated with problems with blood supply in the brain, strokes, things like that. These headaches can feel as bad as your worst headache in the world, but they're very regular.
Okay.
So some people will have a headache that's behind the eye, some people will have it around the temple, sometimes in the back of the head. They tend to be in very specific locations. Sometimes people will see some colored lights and things like this called an aura that presents and that they know the headache is coming. So it's very different from your run-of-the-mill headache, something sort of between the eyes. You take a little ibuprofen and it goes away. These are very regular and ultimately debilitating series of headaches.
Are there different types of headaches, or is it just like one headache and different levels of that headache?
There are definitely different types of headaches.
Okay.
So you'll hear people talk about cluster headaches, you'll talk about migraine headaches and other types. And so sorting out individual headaches is very important for whether these are migraines or whether they're related to other areas.